When I was a child, all those eons ago, my mother used to give me cod liver oil regularly. I had no idea why, and she may not have known exactly why either. I suspect it fell into the category of "this is good for you," which in my house was not a category that invited further questions. I didn't mind. It came mixed with orange and I loved the taste. I thought about that recently. Turns out she was probably onto something. Maternal wisdom. Who knows how it works, but it does. You know that feeling when you're taking medication for ADHD or your child is, and it sort of works, but something still feels off? The concentration is better, but there's fatigue or low mood or brain fog that doesn't quite fit the story of "we found the right pill." I keep seeing the same pattern in clinic. Formal ADHD diagnosis on methylphenidate, Ritalin otherwise known as, or another stimulant, often for years, and nobody has touched the boring biology. No one has looked at the omega-3 status, basic nutrition, iron, B12, thyroid, or sleeping habits. Today, I want to talk about one of those boring things that turned out not to be so boring, omega-3, particularly DHA and EPA, and how it fits into a sensible, non-magical approach to ADHD and brain health. If you're new here, I'm Dr. Michael, family doctor of nearly 30 years of clinical experience. I started in surgical training, worked as a ship's doctor. Most people assume that means that handing out sickness tablets all the time, but it was somewhat more than that. I think about single-handed emergency department, no backup, in the middle of the ocean for weeks at a time. For the last 20 years, I've been in family medicine. I've seen a lot of trends come and go, which means that I've also been wrong about a lot of them. And I try to separate fashion from physiology. I don't always succeed, but I do try. Here's what we're going to cover today. What omega-3 actually does in the brain, what the evidence for ADHD really shows, and why a lot of it is weaker than it looks for a specific reason I'll explain. How I test for omega-3 status and why that matters, the practical questions around food versus supplements, and 4 things that I do in clinic before I reach for a prescription pad. For a long time, omega-3 sat in the nice-to-have category in my brain, somewhere between multivitamins and aspirational yoga. I filed it under things I recommend to patients and then don't think about again, which, if you're a doctor, you'll recognize as a category that it's really embarrassingly large. Then, a bit over 5 years ago, I tested my own omega-3 index, and it came back around 4%, which is on the low side of what most cardiology and neurology research would prefer us to see. So, I did what most of us tell our patients to do and then don't actually do ourselves. I changed my behavior. Supplements and radical move, I actually started eating more fish. Over months and not days, I brought that index to above 8%, and I've kept it there ever since. The fish, I have to admit, was the harder part. At the same time, I dug into the data and it became clear that omega-3 is obviously not just a wellness buzzword. It is a structural component of cell membranes, particularly in the brain. About 60% of the brain's dry weight is fat, and DHA is one of the main omega-3 fatty acids in that fat, highly concentrated in the grey matter and the synapses. It helps keep cell membranes fluid and flexible, which matters because your receptors, ion channels, and transporters all live in those membranes. When the membrane composition is off, the signaling of the cell can change. You sometimes hear the line that the brain is 40% DHA, and that's an overstatement. DHA makes up about 10 to 15% of the brain's total fatty acids, but it's still significant. And the point stands, it's part of the physical structure that allows brain cells to communicate properly. Whether you use that infrastructure brilliantly or to scroll social media at midnight is unfortunately entirely up to you. Now, omega-3 also reduces triglycerides in a fairly predictable way. It has a real, if modest, effects on cardiovascular risk, and it modulates inflammation. It doesn't replace medication where medication is needed, but is one of the dials that we can turn. Now, ADHD specifically. People with ADHD, on average, have lower blood levels of omega-3 than people without. That doesn't mean that deficiency causes ADHD. The brain is not that simple, and anyone who tells you otherwise is probably trying to sell you something, but it's a consistent pattern. Supplementation studies show small but potentially meaningful improvements in some groups. And here's where I want to slow down, because this is important. A lot of the research in this area is weaker than it looks for a specific methodological reason. Now, most studies give a dose and measure symptoms. Very few actually check the omega-3 index before treatment and verify what the blood level is actually achieved through the treatment and for how long. This is a recognized flaw in the literature. There's peer-reviewed commentary stating directly that when you're studying a substance already present in the body, ignoring baseline levels and what's actually achieved and for how long makes trials prone to producing erroneous results. You might be giving omega-3 to someone who's already replete, or giving a dose that never actually moves their levels into a meaningful range, and then concluding that the omega-3 doesn't work. The cardiovascular trial that actually measured achieved blood levels is called REDUCE IT, and it found that the higher the EPA level reached in the blood, the better the cardiovascular outcomes. The trials that didn't measure levels showed much more mixed results, and that's not a coincidence. My clinical approach is to test first, treat to a target level, make sure we get there, and retest. And that's more rigorous than most of the published trials, which is a slightly uncomfortable thing to say, but there it is. The best evidence for ADHD symptom change leans slightly towards EPA-heavy formulations, and studies that run for at least 4 months show the more consistent benefit, which makes sense because you're trying to change cell membrane composition in the brain, and that takes time. The effect size is modest. It is nowhere near what you get from actual stimulants, and anyone claiming otherwise is reading the papers very selectively. The omega-3 index is a blood test measuring the percentage of EPA and DHA in your red blood cell membranes. Red blood cells live for about 3 to 4 months, so it reflects your average over that period and not what you ate yesterday. Because brain cells rely on the same fats, it is a useful window into your broader tissue status. When my result came back at 4%, I was in the range mainly that many research would have called a higher risk, and above 8% is where I wanted to be, and getting there took months of consistent change. I mention this not to congratulate myself. The bar was, to be honest, very low, but because the number matters. The "I'm sure I eat enough fish" assumption is usually wrong, and mine was definitely wrong. And a word on dose and safety. Very high dose omega-3 supplementation, pharmaceutical level doses of around 2,000 to 4,000 milligrams of EPA and DHA per day can increase the risk of atrial fibrillation in people with existing cardiovascular risks and cardiovascular disease. Now, atrial fibrillation is a potentially serious abnormal heart rhythm, which can eventually lead to a stroke. Standard over-the-counter fish oil capsules, which typically contain 300 to 500 milligrams of combined EPA and DHA, are well below the threshold where this risk appears. I'm not raising alarm about sensible supplementation. I'm flagging that more is not always better. Omega-3 also has a mild blood thinning effect, which is not trivial for people on anticoagulants, with bleeding disorders, or heading into surgery. Natural does not mean neutral. Dose does matter. And a few practical points that often get skipped. The best source is food. Salmon and sardines are my first recommendations. High in EPA and DHA, reasonably palatable to most people, and easy to find. Mackerel, herring, and anchovies are also excellent but stronger in flavor, and a supplement that sits at the back of the fridge is not a clinical intervention. One caveat: oily fish, particularly sardines, anchovies, mackerel, and herring, are high in purines, which the body converts to uric acid. For most people, this is not an issue, but if you already have gout or high uric acid, eating these in large quantities can push you into trouble. Salmon is notably lower in purines, which is another reason I tend to recommend it first. On supplements, quality varies enormously. Omega-3 fats oxidize relatively easily, and studies testing commercial products have found that between 40 and 45% exceed recommended oxidation limits. Oxidized fish oil doesn't just lose its benefits, it generates pro-inflammatory byproducts, which is the opposite of the goal. So look for products with third-party testing and a published TOTOX value, which is the standard measure of oxidation. If it smells strongly stale or fishy, that's not normal. Good fish oil should smell mild and clean. One more thing that surprises people: regular exercise increases the body's demand for omega-3. Athletes and regular trainers use more of it in muscle cell membranes, which means that their requirements are higher. Studies on athletes consistently find that lower omega-3 index levels than you would expect to find. And if you're physically active and assuming that your omega-3 status is fine, it's worth actually checking. So, 4 things I do in clinic before I reach for a prescription or before I adjust one that already exists. Number 1, I check the boring biology: iron, B12, folate, vitamin D, thyroid, and the omega-3 index. Start the standard tests that move cognition and mood more than people realize, and that get skipped more than they should. If your iron is low, your thyroid is off, and your omega-3 is 4%, adjusting the Ritalin dose is only part of the story. It's like turning up the radio in a car with a flat tire and no fuel. You might hear the music better, but you're not going to go fast anywhere. Number 2, test and don't guess. An omega-3 index gives you an objective number to start from and something to track. The "I'm sure my diet is fine" assumption has a poor track record, including on my own. 3, food first, supplement carefully. Salmon and sardines are your friends. If you supplement, quality matters more than most people realize. 4, medication is a tool, not a destination. My job is to optimize the foundations first and then see what medication actually needs to do. Sometimes the answer is less than expected. Sometimes the dose stays the same, but the person feels considerably better. Both are a success. If you use omega-3 yourself, or give it to a child, I'd genuinely like to hear about your experience. Leave a comment, what you take, why you started, and what you've noticed. I do read them, and where it's useful, I'll try to respond. Not as personal medical advice, but as an educational conversation. Everything in this video is for educational purposes only. It is not personal medical advice, so please speak with your own doctor about your specific situation. When I raised my own omega-3 index from 4% to over 8%, I noticed some changes beyond the lab numbers in how I felt and functioned day to day. And I'll cover that in a future video, along with sleep, circadian rhythm, exercise, and daily structure, because those pieces are at least as important as any capsule. They're just harder to fix because you can't swallow a pill to get off your phone at midnight. Believe me, people have asked. This is the accidental doctor, trying to practice uncommon sense medicine, one boring blood test at a time. If you found this useful, please leave a comment. I do read them, which is either a dedication issue or a character flaw. I haven't really decided. Subscribing genuinely helps the channel to grow. Stay well, and ciao for now.